My name is Mark Adler. I'm the director of kidSTAR Medical Education Program at Childrenâ, where we educate physicians, residents, nurses, and other ancillary staff to take care of patients. They see simulation as having a benefit for residents to help them become the best doctors they can be. Medical training has always been a bit of apprenticeship, and what the problem with that is that you could be woken up in the middle of the night, run to a bedside, and for the very first time see a problem that you've never seen before in your life and have to manage it. Simulation offers a really neat feature. Every trainee can see the same set of things, and they can do it in a safe environment before they see patients. Our particular interest at kidSTAR is broad levels of skill sets. We're not focused as much on the ability to do a specific task, but rather for a team to be able to get together and accomplish a task together. It's not one person, it's a group that you're evaluating, and that's a bit of a challenge. Who do you evaluate? How do you give them constructive feedback that means something to everyone? There's two ways to do medical education feedback. One is to give it feedback right there, simple, straightforward. Another way is to evaluate learners as a test to see if they're prepared to move on. That summative kind of education is something that requires more effort, but also has a very important role.
The thing about Mark is he's got intense energy, he's got a true sense of research and applied methodology, and he's been a great colleague and an ally to this program.
One of the studies that I did with Dr. Vosnelik was to look at a way to teach emergency medicine residents pediatric emergency medicine information. And the study started off as being multiple days of curriculum and then simulation-based assessment. In the end, we were only allotted 1 day's worth of training. So our curriculum got compressed. What did we learn? Well, there was very limited effectiveness. We didn't see a lot of learning gains. It's all about matching your goals to the amount of time you deliver to learners. Over the past decades, medicine has changed. There are more graduate trainees, meaning more residents, more fellows, more attendings in the hospitals to take care of those sick children. That means an individual resident will have limited opportunities to take care of someone who's sick. So we have to fill in that gap. And simulation is perfectly situated to fill in that gap. We can bring a resident into the sim lab, we can give them a case. Every resident will get that case. We can have them perform and do that until they feel like they can do it correctly. It is standardized training. What's cool about a simulator is everyone can practice and nobody gets hurt. And the learners, they feel safe.
And because we can present a very controlled circumstance to a learner, we know what to expect from that learner in that circumstance. And so simulation is a powerful tool for assessment.
So my hope for all of this is that all the learners develop a better sense of working together, that as a team, they function better. And the better we do that, the better that I can help train physicians and nurses to work together to understand how each other thinks, the better the medical care will be. And if we can improve that, then we can improve patient care and we can save lives.